Okay, here's my audience. You guys look super motivated. Okay. So this speech isn't so much trying to persuade you to feel a certain way, but I'm here to talk about facts about Obamacare and why I believe that it's something that should not be required in our country, and to show you guys the options that you have if you feel the same way as me. So I want to first talk about young families in America, not the established ones that have careers and jobs. I want to talk about those that are starting out, or college students, or even those that have had some trials in their career that has caused them to be lower into the working class. So for average health care, before 2011, I'm going to say that each one of these represents $1. So this is about the amount of what average healthcare would cost a 27-year-old man, woman, family. After Obamacare was passed, it rose over 200% to what average healthcare costs. And that's because of what is now required with Obamacare and the certain steps that you have to take and the certain policies that you have to have in your insurance plan. So if you look at the difference in these, this is supposed to be considered affordable health care, and this was apparently not working. So I'm going to talk about why this happened and what we can do to fix it. So the disapproval rating currently for Obamacare is less than 10%. When it was first brought into the picture and it was talked about and they thought about putting it into law, it was over 75%. But actually, as it actually went down the circuit, people realized the small fine print of the bill and know that it's not working for us. So currently I work in the emergency room at the hospital, and I am a patient access representative, so I work with insurance companies on a daily basis. For an average healthy 27-year-old male, we'll say, they will see their primary care doctor maybe once or twice a year for checkups, maybe throw in that occasional getting sick, but overall they have really good health. Maybe once or twice they go to an emergency room for a broken arm or, something that they couldn't get into their primary care doctor for. Well, most people think that, well, I have Obamacare, that means I have insurance, and I'm going to go to the emergency room and they're going to pay for it. But for 90% of the insurance plans that are listed on the Obamacare website, they have over a $300 premium that this individual is paying on a monthly basis. And when they go to ERs, the base pay that they'll pay as a copay is $200. So just for that one bump or bruise or scrape that you go to the ER for, you're paying well over $500, and you're still going to get billed by your insurance company. This is what Obamacare is saying everybody is supposed to have, and working class families can't afford that. Self-pay patients, people that come into the ER that don't have insurance, they get a 30% reduction automatically on their ER bill because the hospital is aware of the fact that they don't have insurance, and they will get automatic payment plans. And we have some healthcare advisors that will also set them up with charity programs that most likely will pay off their bill. And they are only required to pay a $5 deposit when they go to the ER. That's minimal compared to what a copay is. So people that have no insurance can afford it because they have much less that they have to pay up front, and they get deductions. People with insurance get zero of that. They just have to pay what they can out of their pocket, and if they can't come up with their copay, it's dinged on their insurance, and their insurance company could drop them. So I believe that not having insurance is more beneficial than these outrageous fees that people have to pay for commercial insurance. So I want to talk about what we can do, or what I think is best. I want to propose a plan. So I think a good way to solve this problem would be setting up accounts with employers that take money straight out of an individual's paycheck and put it into a health savings plan. So these are these are things that actually exist now, but most of the time they correlate with insurance. I think it should be a freestanding thing that you can say 5% of each check goes straight into a savings account, and that account can only be used for healthcare purposes. Because if you think about it, that $300 premium that you're paying each month for insurance, if you just save that, when you go to the hospital those 1 or 2 times a year, you could pay it and be done. There would be no insurance company that we have to deal with. So these accounts are something that I think would help out a lot of middle-class Americans that can't afford insurance, and also they can't afford their premium and their deductibles on top of it. I think getting rid of Obamacare would help a lot of healthcare professionals, because in the healthcare field, we know that people that can't afford their insurance aren't going to pay their portion of it. Therefore, their insurance company might not pay their portion of it, and then we're out that money. With self-pay patients, we can set up payment plans, we can give them a deduction, we can help them in the process of trying to get aid through the state. Also, it would take the power out of the insurance companies. They have so much power in these situations because they know that this is something that is required, and so they can choose the standards and the limits of what goes on. I also think that we need to put the power in our own hands when it comes to our healthcare. There is no one size fits all. There is no this exact plan will work for everybody, because everybody's needs are different and everybody uses healthcare in a different way. So the action steps that we can take is petitions or rallies. You can talk to your local government officials. And just talk about it. Get the word out there. If we're just quiet and we go along with policy, then our voice will never be heard, and we'll never be able to say that this isn't right and this is what we think will work. So that's all. Does anyone have any questions?
So you talk about petitions. How does somebody get involved in that?
That's a great question. So petitions, there's lots of different places you can do it. If you go to your local government offices, you can start your own petition, and they'll go through and certify the process, and then you can just go door to door or go to the grocery store, or family members or people that you know that feel the same way about you, the same way you do. You can hook up with them, or also even online. So you can do virtual petitions and get your voice heard that way. Is there any other questions?
Why is Obamacare mandatory?
So Obamacare was first mandatory to help alleviate some of the payments in our healthcare system, but that really hasn't worked in a way unless there's like a catastrophic event, because with people that have deductibles of $15,000, that first $15,000 each year has to be paid by the patient, and if they don't pay it, no one gets paid. So it would help in a situation if somebody got in a car accident and was in the ICU for 3 months and had a bunch of physical therapy, then yeah, the insurance would definitely help in that situation. But for daily or yearly physicals and things like that, it's pointless. So that's all. Okay, and here's my again. Yay!